And now we come to India, where country's most pressing challenge is securing medical oxygen for its COVID patients. Hospitals across the country are reporting shortage of oxygen cylinders. Indian Prime Minister Modi, he chaired a high-level meeting in order to review oxygen supply across the country and discuss ways and means to boost availability. Amid an ongoing crisis for oxygen supply, top officers informed the PM that against the present daily demand from 20 states of 6,875 metric tons of liquid medical oxygen, central government has allocated 6,822 metric tons per day to these states. Availability of liquid medical oxygen has been increased by about 3,300 metric tons per day, with contributions from private and public steel plants and other industries. PM Modi directed top officials to ensure faster transportation of oxygen to the states and fix accountability wherever there are delays due to obstructions. PM also stressed that states should come down heavily on hoarding of oxygen. Earlier in the day, Supreme Court of India took cognizance of COVID crisis on its own and asked central government there to furnish a national plan for oxygen supply. The Chief Justice called the situation a national emergency. Amid worsening COVID situation across large parts of the country, things are turning bad. Some state governments and hospitals, they've turned to the courts now. 6 high courts in India are hearing petitions on oxygen and bed shortages in the country. The shortage has raised tensions between state governments, with some reports of states blocking oxygen supply to their neighbours. So what exactly is government's plan? Well, it is considering importing medical oxygen to relieve the pressure. Plans are being chalked up to buy around 50,000 metric tons of oxygen. But India's problem is not just exceptionally high demand, it is also transportation. The Indian Air Force is being roped in now to airlift oxygen cylinders to remote locations. Railways is being used for rapid and non-stop long-distance transport of tankers. First rake has reached from Mumbai to Vizag to transport 105 metric ton of liquid medical oxygen. Similarly, empty oxygen tankers are also being airlifted to oxygen suppliers to reduce one-way journey time in oxygen supply. The Home Ministry has authorized free interstate movement of medical oxygen. This means state authorities cannot attach vehicles that are carrying oxygen cylinders. Supply to industries has also been banned. This stock will be diverted for medical use. Along with this, medical community has appealed for judicious use of oxygen across the country. Some of India's top doctors, they held a joint briefing on Wednesday, appealing people with mild symptoms to not rush to hospitals and manage their conditions at home under medical supervision. WION now available in your country. Download the app and get all the news on the move.